Hi, I'm Kim Gladfelter, and I'm the owner of PhysioFit Physical Therapy and Wellness. And today we are going to talk about Shockwave. So I'm going to give you a description of Shockwave and try to answer all your questions that you might have about Shockwave. Okay, so I've been a physical therapist since 1994. I'm the owner of PhysioFit Physical Therapy and Wellness since 2002. And I opened this business to provide more personalized, comprehensive care for people experiencing chronic pain and dysfunction. And then in 2003, I integrated Pilates rehab. And in 2007, we added more therapeutic wellness options. And now, today, we provide many integrative health services to support your desire for natural, non-invasive alternatives to help avoid or reduce surgery, injections, and medication. So I added shockwave therapy after seeing amazing results that I knew could be helpful addition to many of our clients who come for physical therapy or therapeutic wellness. So I'm delighted to welcome you here today to discuss the details of shockwave therapy. So we'll explore shockwave therapy and how it can alleviate chronic pain and accelerate your journey to recovery. So let's dive in. So shockwave therapy is regenerative therapy, and it helps people with soft tissue damage or injuries. So it's a natural approach. And if you're struggling to get results you're looking for after you've tried several other treatments and you haven't gotten relief that you're hoping for, this is when shockwave therapy can be really beneficial. Sometimes traditional treatment methods alone either don't provide adequate relief or it takes a long time to get there. So even if you have an acute injury or a recent injury, sometimes it's hard to find the time in your busy lives to take care of the issue, and Shockwave can help for that purpose as well. So we're going to discuss how Shockwave therapy might be a solution that you've been looking for. So how can Shockwave therapy help you? It targets the root cause of pain and dysfunction. So it stimulates the body's natural healing mechanisms, and it improves blood flow to facilitate healing. It also reduces inflammation and disrupts pain signals from injured tissue to the nervous system. So it helps to facilitate the regeneration of damaged tissue, and in doing so, it improves mobility and function so that you're able to return to your daily activities more easily. So why should you choose Shockwave? Well, one reason is that it's an 80 to 90% success rate when it's used appropriately for musculoskeletal issues. It's also non-invasive, and it's a much lower cost when you compare it to surgery and injections. And it helps to reduce the need for pain medications. So the side effects that you might be experiencing with pain medications can be managed more easily with Shockwave. So shockwave therapy has become a preferred treatment option for many people since it offers a more natural approach to healing. So what is shockwave therapy? So this is the unit that we have for shockwave, and it uses the power of high energy acoustic sound waves, which stimulate healing in injured tissue. It's FDA approved for safety and effectiveness, and it treats a wide variety of soft tissue damage or injuries, and even things beyond as well that we address in physical therapy. So how does shockwave work? During the therapy, you have high energy sound waves that are delivered to the targeted body area, and it promotes increased blood flow and tissue repair in that specific region. It disrupts the pain signals and it provides immediate relief. Typically, people get an analgesic effect, and it encourages long tissue healing. So how can shockwave save you time and money? Shockwave therapy can help you return to your normal routine more easily and quickly by accelerating the healing process and reducing the need for multiple sessions. The fact that it's cost effective makes it a practical choice compared to invasive procedures and long-term medication. So as far as how the technology of Shockwave works, I'm going to go into a little bit of detail about exactly what happens. So you've got the central base where the air compressor is, and then you've got this long tube that's a wand, and then you've got this transmitter head that's on the tip of the Shockwave unit. So inside this tube is a little metal projectile bullet that's about an inch long or so. And air pressure travels through that tube inside the wand, and then the tip is a transmitter. The tip on the end is a transmitter that makes contact with your skin. So we set the shockwave at a specific intensity and frequency for air that travels through the tube, and it hits that metal projectile. And this causes it to hit the transmitter tip at whatever frequency or intensity that we set. And then changing the frequency intensity over time for the air compression, and the tip can affect how deep and powerful the energy that's delivered to the tissue is. So every time that projectile hits that transmitter tip, it creates a pulse to strike the tissue and causes a wave of energy. These energy waves then cause cellular changes inside our tissue and allows our body to respond through a natural healing process. So where does Shockwave fit into physical therapy? It can work really well on any body part with damaged tissue, like the spine, so neck, mid back, low back, hips, knees, any joints, shoulder, and then any trigger point area. It can even work on people that have pelvic floor issues, and it can also help for people post-surgery. Any kind of scar tissue that you have that's either from an actual incision area, even if it's from a long time ago, and then also from any kind of repetitive injury, a sports injury or repetitive strain injury that causes internal scarring. So if your tissue is not fully responding due to either scar tissue, a tear, a sprain, or other kind of damage to the tissue through treatments, you may benefit from Shockwave to get to the next level that you've been struggling to get to. So it helps to restore tissue, and physical therapy focuses on restoring your mobility, strength, and function. So the two together help to lead to better overall rehab outcomes. So I'm going to go over a few testimonials just so you get a better picture of how it's helped people in various areas. So before undergoing shockwave therapy, I was struggling with chronic heel pain due to plantar fasciitis, and simple activities like walking or standing for extended periods were excruciating. And after just a few sessions of shockwave, I noticed a significant reduction in pain, and now I can finally enjoy my walks pain-free. And then another person said, that's an avid tennis player, I was devastated when I developed a tennis elbow. And despite trying various treatments, the pain persisted and it was affecting my game. After incorporating shockwave therapy into my treatment plan, I noticed a remarkable improvement and the pain decreased. My strength and range of motion also improved. So thanks to Shockwave, I'm back on the court and playing at my best. And then last one, living with chronic back pain was debilitating. I was hesitant to undergo surgery. That's when my physical therapist recommended Shockwave therapy, and I was amazed at the results. After completing a series of sessions, my back pain significantly decreased, and I regained mobility. Shockwave therapy truly changed my life. So these just give an example of some of the positive impact that Shockwave has made on people's lives. And it's showcasing the effectiveness of helping to relieve pain, improve mobility, and facilitating a faster recovery from various musculoskeletal conditions. So in conclusion, Shockwave is a non-invasive natural treatment to effectively treat damaged soft tissue, and it stimulates the body's natural healing process and provides relief from pain and inflammation. So you can scan the QR code here, click on the link, or copy the link, or give us a call at the number that's on the screen, and we'd be happy to answer any of your questions that you have regarding shockwave therapy. Now, the other thing that I wanted to do was give you a few demonstration videos about how the shockwave technology works in action. Okay, so this is the V actor, and it is helping to release tension and prepare your body for the treatment for shockwave. This is the actual shockwave treatment. And again, it's a more of a global second step to it, where you're going surrounding the area that you have whatever soft tissue damage you're trying to target, and then you're going around the whole area that might be involved and delivering those high energy acoustic sound waves. And this is the last step, and this is where you're getting a little bit more targeted with your specific trigger point areas, and you can focus on a certain trigger point area for a certain number of pulses, and then you can move to another area if you have several trigger points in the region that you're trying to target. Okay. And then just to recap, shockwave therapy complements physical therapy by accelerating healing and reducing pain. It improves blood flow and addresses stubborn condition, enhancing functional outcomes. And it provides a comprehensive, personalized treatment approach. This can improve your outcome and facilitate a faster and more complete recovery from injury or chronic conditions. It helps to regenerate the tissue so we can release your trigger point, tighten tissue, and balance muscles more quickly when you're in physical therapy. So it helps to support your comfort with exercises we give you as well during your progress. So it really helps to enhance the outcome that you're going to have within physical therapy. So now I'm going to just be here to answer any specific questions that you have about shockwave therapy. So one of the things that people have a question about typically is how many sessions that you need to have. So typically when you are coming for an acute issue, then it's typically going to be about 3 sessions once a week. If you have a more chronic condition that you've had for a longer period of time, then it's going to typically be 5 sessions once a week. And that is for a traditional musculoskeletal issue. Sometimes when we are working in more sensitive areas where we have to bring the intensity down a bit, it does make it so that you have to have more sessions. But the typical musculoskeletal issue is 5 sessions. And as far as what you can expect during the treatment process, we're doing, so a lot of times we'll do it as an add-on to physical therapy, and it helps to prepare the tissue for the session, or as a recovery after the session. If you're doing it as a standalone, then it's typically about between 15 to 30 minutes of time, not usually 30, but it varies a little bit depending on what's going on, what your needs are. For the very first session, it would be a longer session if you were doing standalone, because we'd have to do a more thorough assessment first, just to make sure that we're using the technology appropriately for you. And as far as side effects, risks associated with it, so very minimal. Sometimes people get some temporary redness or bruising, and sometimes swelling at the treatment site, because you're provoking the inflammatory process to help facilitate and promote the healing. But that usually lasts at the most for a couple days, and some people don't even experience that at all. So as far as who's a good candidate for shockwave therapy, it is anybody that has a chronic musculoskeletal condition where there's soft tissue damage or injury would be appropriate. And then there's some other areas that can be targeted as well. We can use it for painful periods and endometriosis and many pelvic floor issues and adhesions from post-surgery, from various post-surgical procedures. So the best thing to do is just if you have any question about whether you have an issue that might be appropriate for Shockwave, is just to give us a call, schedule a call to talk to somebody with the QR code that's listed here or the phone numbers here, and we can let you know. We have a screening process to determine if you're appropriate or not. So the good thing is this usually after you continue to progress over time, but usually you'll get the analgesic effect right then and there in the treatment session. So it'll start to feel a little less uncomfortable. Sometimes people do, if they have a lot going on, sometimes people do feel a little bit of tingling and soreness at the time. And depending on if it's more bony area that we're targeting, that's a little bit more sensitive. And then but usually over time, some people right from the beginning start to feel a benefit. Some people, it takes a little bit of time to feel that benefit. Usually, people start to feel better after a couple days if they have any soreness post-treatment. And then sometimes at around the 4th week. So basically, when you do a series of 5 sessions, you want to make sure you do the whole program, because it's kind of like antibiotics. You could slip back, and even if you're feeling better, and you will not get the full benefit of the treatment program. So you want to keep with the program, and then sometimes at week 4 of the 5-week scenario, you might feel, as everything's kicking in more with the healing process, you might feel some people feel a little bit more soreness, but usually by week 5, and then especially 7 and 9, even though you're not continuing to have the treatment that long out, you start to feel even better. And then by 12 weeks, you're feeling significantly better. Usually even by 7 to 9 weeks, you're feeling significantly better. And sometimes, like I said, many people are feeling better even before that. So there's very few reasons why you wouldn't be able to have Shockwave as long as you have the musculoskeletal issue. And that's, we don't do it on somebody that has active cancer, over any malignancy, nothing over a DVT or a deep vein thrombosis, or if you have any kind of implanted pacemaker or defibrillator, and then not on any kind of open wound or infection. And those are basically the main things that would be reasons why we wouldn't do it. All right, well, it was great talking to you all today, and I wish you a great rest of your day, and just give us a call, click on the link, whatever you want to do. If you have any other questions, if there's anything that you wanted to ask more personally, go ahead and just do that. And I will see you later. Have a good day.